When treating a burn, knowing what to avoid is just as crucial as knowing what to do. Incorrect treatments or actions can worsen a burn or delay healing. This guide provides expert advice on common mistakes to avoid for different types of burns and offers insights into best practices for recovery. Applying ice directly to a burn can damage skin tissues and exacerbate the injury. Ice constricts blood vessels, reducing blood flow and slowing healing. Instead, use cool, not icy, running water for 10 to 20 minutes to ease pain and cool the burn. Traditional remedies like butter, oil, or toothpaste trap heat in the skin, which can worsen burns and increase infection risk. Avoid all home remedies that haven't been clinically tested, as they can interfere with the healing process and are not sterile. Stick to cool water and sterile, non-stick bandages for initial treatment. Blisters protect the underlying skin from infection. Popping them exposes the area to bacteria, increasing the risk of infection and scarring. Instead, leave blisters intact, cover them with a sterile dressing, and let them heal naturally. If blisters are painful or large, consult a healthcare provider. Never wrap a burn tightly, as it can restrict blood flow to the area and increase swelling. Burns need airflow to heal properly. Use a loose, sterile dressing to protect the area without applying pressure. This reduces the chance of further damage and allows for comfortable movement. Adhesive bandages can irritate and damage fragile skin around the burn. Remove bandages gently to avoid tearing the skin, which is highly sensitive after a burn. Opt for non-stick gauze pads or sterile burn dressings that don't adhere to the wound. If you use an ice pack, apply it for only a few minutes to prevent skin damage from extreme cold. Extended exposure can numb the area, making it difficult to assess pain levels, which is crucial for monitoring burn severity. Chemical burns require immediate attention. Avoid waiting to rinse the area, flush it with cool, running water for at least 20 minutes. Do not scrub or attempt to neutralize the burn with other substances, as this can aggravate the injury. Seek immediate medical attention for further treatment. When treating burns from acids or alkalis, avoid attempting to neutralize the chemical with an opposite substance, such as using a base for an acid or vice versa. The neutralization process can produce heat, which may worsen the burn injury. Instead, rinse the burn thoroughly with cool running water for at least 20 minutes. For serious burns, seek immediate medical care rather than attempting further self-treatment. Not all burns should be treated with water. For example, burns caused by dry lime powder can react dangerously with water. Instead, carefully brush off any powder from the skin before rinsing with water. Similarly, certain electrical burns should not be exposed to water as they may have hidden tissue damage that requires specialized treatment. Always assess the burn type before applying water and seek medical advice if unsure. Phosphorus burns, often caused by white phosphorus, are highly dangerous and react with air. Exposing phosphorus to air can cause it to reignite. Instead of using water, cover the area with a wet cloth to keep it cool, as water alone may not be sufficient. Seek immediate medical attention to safely remove any remaining phosphorus fragments under controlled conditions. Burns caused by reactive metals like sodium, potassium, magnesium, and lithium react violently with water, producing heat and potentially flammable hydrogen gas. Instead of using water, Gently cover the burn with dry sand or a Class D fire extinguisher, if available, to safely extinguish any residual metal. Seek medical help immediately for proper treatment, as these burns may cause severe skin and tissue damage. Burned areas often swell, which can make jewelry and clothing restrictive and painful. Remove any rings, watches, or tight clothing near the burn site to prevent circulation issues. If clothing is stuck to the burn, leave it in place and seek medical assistance. Certain ointments or creams can trap heat and irritate burns. Unless recommended by a healthcare provider, avoid applying anything other than sterile dressings or prescribed burn creams. Incorrect creams may delay healing and increase the risk of infection. Home remedies may be suitable for mild burns but are unsafe for severe or deep burns. Second-degree burns that cover large areas or any third-degree burns require professional medical care. Attempting to treat them at home can lead to complications, including infection and permanent scarring. As burns heal, they may itch, but scratching can tear the skin and introduce bacteria, leading to infection or scarring. Instead, apply a doctor-recommended moisturizer or take an antihistamine if the itching is severe. Keep the area clean and protected to promote healing. Newly healed burns are highly sensitive to sunlight. Sun exposure can worsen scarring and cause pigmentation changes. Keep the area covered with clothing or apply a broad-spectrum sunscreen, SPF 30 or higher, once the skin has healed sufficiently. Alcohol and hydrogen peroxide can irritate and dry out burned skin, hindering the healing process. Instead, use a gentle, sterile saline solution if necessary, or follow a healthcare provider's instructions for wound care. Certain types of burns require immediate medical attention, including those that involve the face, hands, feet, joints, or genitals. Burns in young children, the elderly, or people with weakened immune systems also warrant medical evaluation. Applying pressure can damage the skin and tissues further. Burns should be loosely covered and elevated if possible to reduce swelling. This allows the area to heal without additional trauma. While a cool compress can help initially, prolonged moisture can macerate, soften and break down the skin around the burn. Limit compresses to short intervals, and dry the area afterward to maintain skin integrity. Infections are a common complication with burns, especially second and third degree burns. Watch for redness, swelling, pus, or an increase in pain, which could signal infection. Clean the area gently and change dressings as advised to minimize infection risk. Many burn myths persist, like using egg whites, raw potatoes, or vinegar to treat burns. However, these can worsen burns and introduce bacteria. Did you know that even plain water can outperform many home remedies? Evidence supports that clean, cool water is the safest initial treatment for burns. Stick to simple, evidence-based treatments. Use cool water immediately, apply a sterile bandage, and seek professional care for deep burns. Keeping it simple and following expert advice ensures faster and safer healing. Understanding what not to do when you have a burn can prevent complications and speed up recovery. By following these expert recommendations, you can ensure the best possible outcome for any burn incident. Thank you for learning about proper burn care. Avoiding these common mistakes can make a significant difference in recovery and long-term outcomes for anyone dealing with a burn injury.